So let's start with the big picture. Tell me who you are and what it is that you do, and how did you come across this thing called PEMF?
Yeah, my name is Dr. Bob Ducharme. I'm a chiropractor in Rochester, Michigan. I've been in practice for 44 years. I originally heard about PEMF from a friend of mine whose son had unfortunately contacted cancer, a sarcoma in his leg, and he was asking me if I knew of any different treatments that would be available to him, and we had talked previously about PEMF, and there was starting to get to be some scuttlebutt about it early on in the chiropractic world, and so we started looking for research and things that so we could learn a little bit more about it, because I had problems with a knee that I had busted up playing high school football, and had 2 surgeries before I left high school, and I was bone on bone for a significant number of years, and I was trying to find something for pain relief, and the PEMF did a significant job of doing that. And actually bought me about 10 more years of time that I could continue to function before I had to have it replaced, and I just had it replaced a couple of years ago. At the age of 67. So, you know, I did very well with it, and it did buy me a lot of time.
Well, let's back up here a little bit. So first of all, I want anybody listening to know that we're not making medical claims here about curing cancer or doing anything like that. This was a situation, and everybody believes there was some support there, but this is not a clinically studied proof related to cancer. But it is interesting to hear people see benefits that they would attribute to a machine like the PEMF8000, correct?
That is correct. And, the one thing about a PEMF machine is that it doesn't actually heal any disease. What it actually does is it heals the cells and the tissues of the body. And that's it's something that it's extremely good at. It was originally developed to help heal non-union bone fractures, and those would be bone fractures where people had very low blood supply, and consequently the bones would not heal. And so this machine was originally developed by a doctor to help heal unhealed bone fractures.
So, Doctor, you've mentioned some situations where people had extreme health challenges going on, and then your own personal experience with your knee and things like that, as well as your patient. How would you summarize what PEMF is able to do for most people in general?
The one thing that PEMF does is, like I mentioned before, is it helps heal your cells. When cells become injured or they become infected, there is a electrical balance in the cell wall, and that cell wall, because of the imbalance in the electrical portion of it, it's a force that's created by what we call a sodium potassium pump. And what happens is that becomes aberrant, and it doesn't work the way that it should. As that happens, the cell wall collapses upon itself, and it no longer allows nutrients to get into the cell. And the worst thing is it doesn't allow waste material that's produced within the cell to escape. And so consequently, cells become toxic, and they eventually die from a process called apoptosis. The thing that the PEMF does is, by inserting the energy through a magnetic force, is that it helps to right that electrical supply issue in the cell walls. And so if you can heal cells, cells are the basis of tissue, and tissue is the basis of organs, and organs are the basis of the human body. So what we're doing is we're starting at a cellular level and allowing it to heal, and as it heals, then the other tissues do too. Not everybody that comes into my practice uses a PEMF. machine. That's usually used with people who have severe injuries or have severe maladies that that are in dire need of that kind of a treatment. In my practice, I treat a lot of athletes at all different levels, professional levels, collegiate levels, high school levels. I also use it for people who have long time injuries that have been there for a long time and have created other maladies in their body, and it helps to expedite the healing process. And then I have a lot of people who use it just as a source of recreating energy in their body, because it helps them feel better. It calms them down. It gives them more energy to just live a more productive life.
And you said you've personally used this technology to help yourself?
I have, and in fact, I use my machine, at least 3 or 4 times a week for, at least a half hour at a time, and I do it mainly for recovery. The one thing that this thing really helps with is like professional athletes and athletes that perform at high levels. One of the biggest things for them is recovery. And that recovery, what it basically means is that when your body is very active, it produces a lot of lactic acid and other excrements that are toxic to the body. And by using the PEMF machine, what it does is it helps the blood system exchange more oxygen from the lungs, and so your oxygen level goes up. As your oxygen level goes up, your body becomes more efficient at excreting the toxins that were produced from the activity that they do. So typically an athlete would take 2 to 3 days to recover after a significant event, and with a PEMF machine, usually a day later they're ready to go. I treat motocross racers. I actually have treated in the past NASCAR racers and their crew members. I also the area that I lived in used to be close to where the Detroit Lions facility was, and for a period of time there, I took care of quite a few of the Detroit Lions players. Some of which are retired now, but still come to see me for the recovery phase of having played football for too many years.
How do you think the PEMF 8000 Pro compares to a lot of other systems out there?
Having studied them long before I ever bought one, I looked at all of them, and the thing that drew me to the PEMF 8000 was the ability of it to not only produce magnetic pulses at a high level, but also to produce them at a low level. And one of the things that really makes the PEMF 8000 work extremely well is that even during the level that you do, it's automatically built into the software of the machine, where it will work up and down the scale a little bit. Different tissues require different levels of magnetic pulse in order to affect them the most. Typically, nervous tissue is at a lower level, and muscles and other tissues like that are at a higher level, and some of the organ tissues are kind of in the middle. And so what the PEMF 8000 does is during its cycle, it goes through all of those different levels, so that it helps, not only from the cellular level all the way up to the deepest muscle tissue that you can get to. There's there's a lot of things out there that are affected by pulsed electromagnetic field therapy. The simplest ones are the joint and muscle issues that people have. That one is probably what we use the machine for the most. It is extremely good at aiding and increasing or decreasing the healing time of bone tissue, which is what it was originally used for. I had a patient that was in Florida for the winter, and 2 weeks after he had arrived down there, he fractured his tibia fibia, and so consequently he was, really upset because he was planning on playing a lot of tennis during his vacation months down there, and he was down there for a period of almost 5 months, and when he returned, he was still in the cast, and I asked him, I said, so why are you still wearing a cast? And he said to me, he goes, my bones won't heal. And he says, they're talking about, doing rod implants, and, they're talking about doing all kinds of, other things. And I said, well, I have was originally for that, was for helping heal bone tissue that wouldn't heal. And so we started using it on him, and lo and behold, 4 weeks later, the bone had started to create the healing callus around it. And 6 weeks afterwards, he was able to get the cast removed, and he was got a boot, and he was able to start walking again on, which he hadn't done for more than 5 months. And so it helps a whole bunch with with fractures. And then it also it works extremely well for maladies that that don't seem that they're associated with the machine, but things like MS. I have a number of patients that not a number. I have currently about 4 patients that are suffering from ALS that are using the machines, and finding symptoms have abated. The thing I find with the machine, and there is research out there relative to the use of PEMF and ALS, but the thing that I've found with my own personal clinical experience is that it doesn't heal the disease. And I think that people need to understand that ALS is a disease that affects your central nervous system. And whatever has been damaged prior to that is probably not going to, recover. But the thing that it does is it keeps the tissue that may be damaged in the future from happening. And so I've seen that happen with 4 patients that that I've treated. 2 of the patients have their own machine. One of them is leasing a machine from me, and the other one is coming here to the clinic and uses a machine on a regular basis. The name of the practice is Ducharme Chiropractic Center, and I am in Rochester Hills, Michigan. I've been there for 44 years, like I said previously, but I love helping patients, and I'm a doctor that will do whatever I can do to help you with whatever malady that it is that you have.